Hiya, I'm Deborah Robson. I am the Student Wellbeing and Progress Manager here at the Regis School, and I'm the Senior Mental Health Lead. The Regis School is part of the United Learning Academy Trust. We're here based on the south coast in Bognor Regis, and we currently have approximately 1,700 students on roll in an 11 to 18 year secondary school. I think the biggest challenge for children's mental health and wellbeing at the moment is the volume of young people that are needing help and support. We've certainly seen an increase in mild to moderate cases of mental health difficulties, certainly since the pandemic, and we want to make sure children feel really safe about coming to school, feel able to connect and make good social relationships, be able to engage really well in their learning, and not have some anxieties that perhaps have manifested themselves as a result of some of the lockdowns and some of the changes that young people have experienced. So I think our biggest challenge is that there is a large number of children needing that support, and accessing help for them can be tricky. So I think COVID has left behind higher levels of anxiety. I think we see that in both social anxieties, children learning to reconnect, form friendships and develop lifelong relationships and understanding. But we've also seen where there have been gaps in learning. Different children at different stages had different school experiences when it was online, and although we were able to offer quite a comprehensive online package, not every child experienced that. So what we're seeing, maybe third year through now, is there are some anxieties around learning and confidence in learning. So that's something that makes children find it more difficult to kind of access school and want to be part of what we would have normally expected. We were really fortunate. We were really passionately driven by student voice here at the Regis School, and our student council very much came forward once we came back into schools and said that sometimes young people don't always want to talk to an adult. So we developed a student prefect system and used the Mental Health Schools Ambassadors programme as part of that to develop it. It means that a targeted group of young people who volunteer now to run a social wellbeing hub every lunchtime has been growing, and we're now open 5 days a week, and children get to come and talk about their worries or their problems or connect in a really safe environment. The prefects have had a range of training which has enabled them, if a difficulty comes up that they can't resolve or give advice for, they know which adult to go and approach and speak to. And we've just this week, whilst it's Mental Health Awareness Week, we've just done a big promotional standout in our reception to try and widen the knowledge around positive mental health and capturing the concepts around some of the stigmas that still exist for mental health out there, and helping children realise that it's a good thing to have good mental health and to know how to access it and gain support. We now have written into our health and wellbeing policies all the different avenues of support that we have, which include the offer of the Thoughtful programme to children and families. We've got a team of practitioners that are in who are accessing support for children. We have over 60 referrals last year for young people who specifically came forward to look for a resource. What's great about the programme is it's here in school, it's with adults that are familiar to children, it's an environment where children already know and feel comfortable. Parents and carers have been very positive about its impact when we've done feedback work with parents and carers. So yeah, it's been something that has been enabled a change. It wasn't here before, and it is something that we hope will continue to grow because the children at the Regis are absolutely expressing positive kind of responses to the work that's been done with them. Initially, it was about resourcing staffing that would be able to coordinate that. So that's where I took on the role as Senior Mental Health Lead through the government's funding, and went through a provider that was able to give us a good, solid foundation to start with. And then it was the collaboration, working with the school's advisors team in Thoughtful and the practitioners that were assigned to us. It's been something that has had an incredible impact. So it's been easy once it was up and running to get going. We've been able to train all of our heads of year and directors of year to be able to do referrals into Thoughtful. So we have a wide capture of pastoral staff who hear children's voices and maybe worked one-to-one with a child. It's strengthened our school counselling offer, where we do have a formal counsellor in place, but with a school of our size, one adult to 1,700 young people, this has strengthened that support to children. It's also the fastest accessible service to children currently in West Sussex. We know that there are long waiting lists for other providers, and whilst those providers can give fantastic support, for a child with us, they're here, they're today, and their needs are needing to be met. So it's great that there's a shorter kind of pickup. We've done analysis work with the school's advisor. We've been able to share that analysis with our governors, so it's gone out to our wider community. We publish some of the documentations, and training goes out to all of our teaching staff, and we also share and capture things in our parent bulletin and newsletter. Most recently, the new work that's going on with Thoughtful at the end of this month with a parent workshop. So some of the challenges are around the stigmas that are attached to mental health. It's still something that people think that if they talk about, they'll get judged. Maybe children view that they may get targeted for bullying or discrimination. So we've been working really hard on our tutor programme and on our PSHE programme and our relationships and sex education programmes to help children realise that positive mental health is as important as physical mental health. And it's sometimes the things that you can't see that are the most difficult things to deal with and to manage. So some of the challenges have been about encouraging children to open up and speak out. It has taken a lot of nurture work. We're fortunate we have a large pastoral team and very dedicated staff who feel passionately about caring about students' wellbeing. And we've coupled that with staff wellbeing as well. So we've learnt some things that we've been able to adapt for adults as well through the work that Thoughtful have done. But yeah, so it continues to be a challenge. I think possibly at the moment I would say boys are our single biggest challenge. Getting boys to drop some of the ideas, the preconceived ideas that they have, or the stereotypes that they have around boys being able to cope or men being able to be seen to be able to manage. So we're working really hard with the Thoughtful team as looking at how we can break down some of those barriers, and identified a boys space group and recently did some student voice work particularly targeting boys. So that's kind of where we're heading. We're trying to widen it so that more children get to access it and boys feel more open to discussing their thoughts and feelings. Having a recognition and a normalisation that this is okay. It's okay to experience some of the mild to moderate symptoms that you might get as a result of mental health difficulties, and to build resilience and self-confidence and self-esteem, because most of us, most of the time, can manage these things quite well. And when there's a need for additional support, that they know exactly how to access and help is accessible to them. I think reduction in long waiting lists in wider services would be a huge benefit to young people, but there's work we can do at the grassroots, which is where we sit as an education provider to make sure that we equip children to manage things, perhaps they're not reaching crisis or needing higher services to come involved. So I think really strongly changing people's attitudes towards mental health is something, if I could do that tomorrow and there wasn't the stigmas attached and the stereotypes existing, that would make life a lot easier. We're quite fortunate. We have really quite a diverse demographic at the Regis School. We've got a large number of children from a large range of backgrounds, and we work really hard on diversity and inclusion, and one of our goals is to be a fully inclusive school, and behind that it underpins in our values kindness. And so it's really quite easy for us to kind of work with all children and promote whatever we're trying to promote for them, to improve them as both individuals in the classroom, but also as lifelong learners and lifelong citizens. I think possibly there are still stigmas attached to certain demographic groups. So as I've mentioned, boys particularly having some ideas and stereotypes that limit their ability to talk freely and openly about mental health. I think sometimes we do see some communication difficulties with some of our EAL families where English isn't their first language. So it's working with Thoughtful to kind of get the messages out there, because we know that the young people would receive the support and the families would be willing to accept the support, but perhaps their understanding of mental health, given that not every language carries the same understanding across languages, that would be something that we'd want to improve and develop going forward. It's been absolutely brilliant being part of Thoughtful. I really don't know where we'd be without them. Um, it's strengthened our offer for children in terms of their well-being. It's put well-being at the top of our agenda as part of what we are doing as a school to kind of improve children's overall health and progress. We know that a happy child, a settled child, is a child who's going to thrive and do very well educationally, but also out there in the real world when things can be really, really tricky as they get older and they embark on more adult responsibilities. Our parents that have been involved directly in the scheme have given fantastic feedback for how it's helped and supported their children. It's strengthened our transition offer, so it was obviously very difficult during the transition years over the pandemic, and actually being able to connect with some young people who found the jump between primary and secondary much harder. The Thoughtful work has enabled them to overcome some of those mild anxieties that they were experiencing. It's worth its weight in gold, and if I could have a Thougful worker in every single day, I could find students who would benefit from that. And they get involved not just in what they do as practitioners, but they come and get involved in the promotion of wellbeing and health for young people across the school, and I've worked with some of our other partners in health and children's services. So it's been brilliant. I couldn't thank you enough. I just think it's got huge value, and I would like to see that, you know, it continues to grow, that every school in West Sussex actually has a Thoughtful programme and has practitioners attached to it. I think if we start at grassroots level, right down even, you know, nursery and primary age groups, we can really strengthen children's resilience and self-awareness and compassion, and it will strengthen their ability to work together as well. So it's very, very important that we work together and we continue to strive to make the difference.